Gout today. My two drugs of choice are going to be colchicine and allopurinol. So, gout is characterized by high levels of uric acid in the blood. These high levels of uric acid in the blood then contribute to formation of uric crystals in the joints. It most commonly affects the big toe of the foot. It was formerly called the rich man's disease because of the lifestyle factors. Commonly, it's found in men aged 40 to 60 who have a diet high in alcohol and animal proteins. Gout can be treated through the use of several medications and lifestyle changes. The first medication I'm going to talk about is colchicine. Colchicine is a plant alkaloid, and it is used for the treatment of acute gouty attacks. It binds to tubulin, a microtubular protein, causing its depolarization. This disrupts the cellular function and mobility of granulocytosis. This decreases their migration to the affected area. So it basically disrupts the uric acid and then prevents it from forming the crystals in the most common area, the big toe or the joints. It has anti-inflammatory properties to it, so it is used for acute gouty attacks. It does have several adverse effects, though, mostly GI issues such as nausea, vomiting, and abdominal pain and diarrhea. It is administered orally and is absorbed in the GI tract. Colchicine, cost-wise, used to be fairly cheap in a genetic form. New regulation through the FDA, because of all of the adverse effects, has raised the price of colchicine, and it can be as much as $200 a month. Colchicine is frequently replaced by NSAIDs now, though, because they can use NSAIDs for the anti-inflammatory effects and then use corticosteroids and allopurinol to help with the uric acid. So allopurinol is used for long-term control of gout. Allopurinol is a xanthine oxidase inhibitor. It reduces the production of uric acid by inhibiting the last two steps of uric acid biosynthesis. It's very effective in lowering the uric acid amount in the blood. Allopurinol can be curative as long as the patient doesn't have too many lifestyle issues. The cost of allopurinol can range from $18 to $100 per month, depending on the severity of the disease and the duration of the medication being taken. It really doesn't have that many adverse effects. Most common is a skin rash. It does need to be watched in patients with existing kidney disease. As far as safety goes with these medications, they're both taken orally. They're normally taken by men aged 40 to 60, so there's probably a low risk of overdose or poisoning from it. You're going to be taking them daily. Allopurinol starts with a lower dose and then leads up to a higher dose. In addition to taking these medications, the patients are going to need to make lifestyle changes if they do have the existence of high alcohol use and high animal protein diet and obesity. It'll be the nurse's job to help counsel these patients on what they'll need to change to improve their outlook with gout. Both of these medications and NSAIDs and corticosteroids can be curative for gout, and patients can go on to live a long, healthy life.